Assemblyman Azariti, excuse me.
Thank you, Madam Speaker.
Okay.
On the bill. Thank you. I'm strongly opposed to this bill, which transfers longstanding primary references to the Federal Advisory Committee on Immunization Practices to the New Jersey Department of Health. And I have numerous concerns, including that the primary impetus for this radical change is political, as this is based on disagreement with the President's administration in Washington. The acting Commissioner of Health appeared in front of the Health Committee, and importantly, I would like to know from him what is the process by which vaccine decisions are going to be made. It's hepatitis now, because that was at issue in Washington, but are we adding others? Are we taking some away? There's no public input, there's no legislative input, and the outside medical organizations used as consultants in the process, they may not always agree. Medicine is science, but it's also art. So oftentimes there's not agreement on how to proceed. So who ultimately decides? Is it the commissioner, him or herself? Is it going to be the people around the governor telling the commissioner what to do based on political considerations in Washington? Is it going to be media consensus, as it was during COVID when they told us without evidence that we had to be vaccinated to prevent spread, we had to distance 6 feet from one another, that we had to wear masks, that our children couldn't go to school, that we could only get together for Thanksgiving with an arbitrary number of people, that it was okay to send seniors back with COVID back into nursing homes? The point is that the people need and deserve to have trust and confidence in such important decisions being made by the department. And given our COVID experience, it would be a stretch for anyone to feel comfortable with this shift from national standards to the will and whim of the department. So with regard to this shift, we need legislative oversight, we need public input, we need transparency and confidence that these decisions are evidence-based. We need to assure that there are no conflicts of interest with regard to the outside organizations advising the department. We need clear medical and religious exemptions. The most important thing we need is for our citizens to trust that the department is making decisions based on the right inputs and not political considerations. Therefore, for these reasons, among others, and in the best interest of the health of our citizens, I vote no, and I urge my colleagues to do the same. Thank you, Madam Speaker.
Thank you, Assemblyman. Assemblyman Schaffenberger.
Just so I'm clear, this is 6166, right?
Yes.
Okay. Thank you, Madam Speaker. There are a number of major concerns with A6166, namely issues of oversight, accountability, and informed consent. With a number of new entities making recommendations, it is unclear whose policies will be instituted in the event of differing conclusions. Also, will the VARs still apply in the same way under the expanded framework? Will New Jersey establish its own vaccine injury compensation system, or will families be left without clear recourse if harm occurs? Until these and other important questions are addressed, this bill should not be moved forward. Thank you, Madam Speaker.
Thank you, Assemblyman. Assemblywoman Fantasia.
Thank you, Madam Speaker. I rise in opposition to this bill. This bill fundamentally changes who controls vaccine policy in New Jersey, and it does it so in a way that moves authority away from the public, moves it away from transparent national standards, and into a closed system inside the New Jersey Department of Health. And I didn't know a lot about this when this bill landed on our agenda. So in my research, I found the following. Right now, New Jersey relies on the Advisory Committee on Immunization Practices, or ACIP, which is a national body that operates in the open, publishes data, it debates in public, and it records its votes. Its guidance is consistent across all states, and it's subject to federal transparency and oversight. That matters because vaccine policy touches everybody, every employer in this state as well. But this bill removes that safeguard, and it takes ACIP out of our law and gives sole authority to the New Jersey Department of Health, which allows the Department of Health to set vaccine requirements on its own or in coordination with public health groups that New Jersey voters cannot see, we can't subpoena them, and we can't hold them accountable. That's not a small technical change. This bill is actually an incredible transfer of power. The Department of Health is already partnering with Northeast Public Health Collaborative, which is a multi-state coalition that works on vaccine policy and disease surveillance, but that organization is not subject to Oprah, not subject to New Jersey courts, doesn't answer to us as New Jersey legislators. Yet under this bill, the Department of Health could rely on those regional recommendations and enforce them as binding policy on our residents. This does not work. This was not thought through properly. That means decisions affecting our children, our workers, our families are made in rooms that the public's not allowed to enter. Maybe we aren't even allowed to enter as legislators. So this isn't hypothetical. We just saw what happened when Public Health Authority operates without transparency. So on December 19th, 2025, just not quite a month ago, Public Health Council adopted major code changes under conditions that should concern every single person, regardless of party, in this chamber. Members of the public were locked out of a part of the meeting because of a bad access link. Materials were missing. Amendments were not properly circulated. Even council members complained that they didn't receive full documentation in advance. That same council would be given expanded power under this bill. If that's how public health rulemaking is handled now, why would we give them more unchecked authority? Doesn't make any sense. ACIP gives us a nationally consistent, evidence-based, transparent framework. Does not prevent New Jersey from protecting public health. It ensures that those decisions are made in the open and anchored to a process that can be examined. It can be questioned by us. I can't imagine, why would we write a law that would keep us out of the room? It's silly. This bill removes the anchor and replaces it with a system that is more insulated from scrutiny and more concentrated inside one agency. So parents are being asked to comply with mandates that affect their children. Our workers are being asked to comply with mandates that affect their livelihoods. The least we owe them is a process that's transparent, accountable, and grounded in standards they can see and are open to public record scrutiny. This bill moves us in the opposite direction. For that reason, many others, I can't support it. Thank you.
Thank you. Assemblyman Knitra.
Thank you, Madam Speaker. All right, I see about 20 of you on your cell phones right now, and I assume that you're publishing your academic papers on virology, since you guys are clearly all experts right now and want to take away federal oversight from our Health and Human Services Department. Now, I didn't get the years of training that apparently all of you guys did, so instead I tried to conduct my own research. I had my office reach out to the U.S. Department of Health and Human Services and the CDC. And HHS and CDC gave an extensive education on why they made their recent immunization changes. What stood out the most during the discussion, though, was simply the unmatched expertise and manpower that they bring to the table. The U.S. Department of Health and Human Services has around 62,000 employees, of which 12,000 are with the CDC, whereas the New Jersey Department of Health has only 5,000 employees, and we have nothing at all truly like the CDC. Now, not only that, but these federal bureaucrats at CDC and HHS are top-level experts, despite what you want to think. Most are globally renowned communicable disease experts or virologists. I'll give you some examples. Jeffrey Taubenberger, PhD, acting director of the National Institute of Allergy and Infectious Diseases. This dude is the guy that was the first to actually sequence the genome of the 1918 influenza pandemic virus. Bernard Moss, PhD, chief of laboratory and viral diseases at NIAID. His expertise is in pox viruses and viral pathogenesis. He developed vaccinia-based viral vectors used in vaccine technology. Julie Ledgerwood, she's the chief medical officer and chief of clinical trials program within NIAID. Her expertise is clinical vaccine trials, including Ebola, influenza, HIV, malaria, Zika, and other pathogens. At best, New Jersey has a tiny virology program in the public health and environmental laboratories, which, as far as I can tell, is primarily limited to testing. It would be absurd to not lean on our federal partners who are significantly better equipped than we are. Additionally, the federal government just completed the most comprehensive, expert-driven review of childhood immunizations in decades. This review was conducted by scientists at CDC, FDA, NIH, and CMS, the top public health and epidemiology experts on the planet. These experts concluded that the previous U.S. schedule was an international outlier. Far more shots in the U.S. for far more diseases than our peer nations across the globe. In 2024, U.S. children were receiving 84 to 88 doses for 17 different diseases plus RSV, which was more than any other nation in the world. Denmark, by comparison, vaccinates for only 10 diseases with only 30 doses and achieves extremely high uptake without any mandates. The CDC is still recommending that all children get vaccinated against diphtheria, tetanus, whooping cough, Hib, pneumococcal conjugate, polio, measles, mumps, rubella, and HPV, for which there is international consensus, as well as the chickenpox. But there are a litany of vaccines that were dropped recently, and for good reason. Here are just three. Hepatitis A was dropped. The U.S. incidence of hepatitis A last year, 1 per 100,000 people. Mortality for it is 1 per 10 million, mostly older men, not children. 0 deaths in New Jersey this past year. Rotavirus, pre-vaccine mortality in the U.S., 3.3 deaths per year among all children under 15. Post-vaccine mortality, 1.6 deaths per year. 0 deaths in New Jersey this past year. And look, if you'd like me to get off all the statistics that show how validated all that was, I'm more than happy to. But because the bottom line is simple. Your guys' Trump derangement syndrome is simply making you unable to accept anything positive that our president's administration does. This bill is attacking the federal experts, not because of science, but because you cannot accept that President Trump and RFK Jr. directed this review and that the science supports their positions. Don't let your own pride hurt the children of New Jersey. Thank you.
I would love for us to have decorum and not have name calling. Let's go with Assemblyman Peterson. Thank
On
you.
the motion,
Thank
right,
you.
Mr. Bergen? The motion is the question, right? Or whatever. I've heard, I'm not going to reiterate everything that was said here today so far. I agree with all of it. What I'd like to speak to is in the Health Committee, the Commissioner of the Health Department came, and basically his testimony was that the CDC is bad and using, quote, pseudoscience, and that we should empower the Department of Health to make these very important health decisions, which will impact every child in New Jersey. And I asked the commissioner why we should entrust them with this magnitude of a health issue after this same department thought it was wise, thought it was good decision-making to put COVID-infected people in nursing homes instead of President Trump's mercy ships and field hospitals. And that resulted in 8,000 New Jerseyans dying. 8,000. Think about that. We went on a 20-year war for 3,000 people. 8,000 people died. And I don't trust them to make any kind of decision for me or for my family, and quite frankly, for anybody, because they haven't earned that trust. He couldn't explain why we should trust them now after such a horrendous decision was made by these folks. Additionally, what he did speak about a little bit, he didn't tell us how he was going to make these decisions, He didn't tell us how he was going to come up, other than to state that he was going to look at different medical associations and determine from there what to do. I just want to remind everybody that some of those medical associations that he referred to in his testimony have stated that men can get pregnant. Want to talk about pseudoscience? That's pseudoscience. Now, that being said, I for the life of me, I don't know why we're doing this. I don't know what we want to do this for. There's two more things that I have a problem with transferring this decision-making to the Department of Health. It's been my experience, just from observation, that many department heads, when their time is up, they end up going and working for the very people that they regulated while they were here. How will anyone in New Jersey trust that the decision makers on the vaccine schedule won't end up at some pharmaceutical, won't have made the decision to get a good job with a pharmaceutical after they're done their time here as a commissioner or a senior level decision maker? I have no trust. And then finally, during the committee hearing, there was testimony about whether vaccines that were on the New Jersey vaccine schedule but not on the CDC vaccine schedule would be covered under the Vaccine Injury Fund. Now, that's a fund that if you have an injury from receiving a vaccine, it compensates you, especially for the medical care that comes with it. And we did a lookup of it, and reading from the website of the government agency that provides this vaccine injury fund, it states very clearly that that they only covers the vaccines that are on the CDC schedule. So you are going to allow the commissioner to put vaccines on a schedule that children will have to take, and if they have a vaccine injury, there will be no financial recourse for that family. That's a big risk to ask people to take. This bill was poorly thought out, it was reactionary, it was political, and quite honestly, everyone should vote no. Everyone should vote no on this bill because it's not about science, it's about political science. Vote no.
Assemblymember Rumpf.
Thank you, Madam Speaker. I too rise in opposition to this bill, Madam Speaker. I believe that finally we are in fact addressing the health, safety, and welfare of our population. This, perhaps more than any other bill on our agenda today, is of great significance, and I believe we are doing a severe disservice to all of our residents by rushing it through on the last day of the legislative calendar. As stated by all the speakers before me, Madam Speaker, to change from the Federal Advisory Committee on Vaccine and Immunization Practices to the State Department of Health with respect to the manner in which we choose to immunize our children and the rising generation of New Jerseyans does not deserve to be moved so quickly. I did not receive satisfactory answers from the Commissioner of Health when he appeared before us, and by the time Dr. Azariti was ready to question him, he had left the room. Apparently, it wasn't of such significance to the State Department of Health that it warranted a full exploration by our committee. Regardless, Madam Speaker, the United States has population of 350 million individuals. The state of New Jersey, depending upon the count you choose to take, is around 9.7, 9.8 million. There's a reason that vaccine information and vaccine schedules are centralized within the federal government. People are transient. We keep hearing these stories about people moving out of the state, but the fact of the matter is people also move into the state. It is a very transient population, and having each state regulate their own immunization practices is simply an abhorrent example for us to be setting. We are taking what is one of the most serious decisions that we potentially could make as a legislature, and we are making it political. It is truly a decision that should not be political, but we're the ones politicizing it because certain people within the state of New Jersey perhaps no longer trust the federal government when it comes to vaccine practices. More than anything else, what consideration of this bill does is it further erodes the public trust in vaccines. And that perhaps, more than anything else, is the worst thing that can happen. And that is exactly what is happening with this bill, Madam Speaker. I intend to vote no on this legislation.
Thank you, Assemblyman. Madam Clerk, open the machine for a vote. Are all recorded who wish to be recorded properly recorded? Madam Clerk, close the machine and take a tally.
Madam Speaker, Senate Bill 4894 has received 51 votes in the affirmative, 24 in the negative, and 0 abstentions.
Senate Bill 4894, 4727, having received 51 votes in the affirmative, 24 votes in the negative, and 0 abstentions, I declare the bill passed. Let the bill take the usual course of passed bills. Bill on the clerk's desk.